Value basically is if you're the person we're delivering the care to, do you get the outcomes you want and at the lowest cost, not only by money but by inconvenience and so forth. So that's really what drives and should drive our delivery of health care. Outcomes are still very difficult to measure in medicine. Hospitals have some of those outcomes, but they're buried in their EHR. Insurance companies actually have a lot of outcomes, but they're buried in ICD-10 codes. And the government has a lot of outcomes, but they're also buried as well. So until we get better in the healthcare delivery system and sharing those outcomes, we have to get a hold of them the best we can, and we're working on that. Until we have a good handle on outcomes, for example, for our protective lung ventilation initiative, we have to focus our processes on things that we know from the literature will affect outcomes. So in other words, we can't follow our own outcomes because we don't have them. So we're going to focus our processes on things that we know from the literature, best practices do affect outcomes. So it turns out in ICU care for a number of years, we've known that if we ventilate patients in certain patterns, the respiratory complications we get later are reduced. So we're applying that now to the intraoperative period as well. And so we can't measure outcomes, we're trying to get a hold of them. In the meantime, we can measure compliance with that process. In other words, the ventilator's set the way we want it to be X number of times, that's success in that process. And so we follow the data from our own EHR as to what the settings of the ventilator are, the positive end expiratory pressure settings, et cetera. We measure how closely we can follow those parameters that were within that initiative. That doesn't necessarily improve outcomes, but we know from the literature that if we're better at that process, it probably will improve our outcomes. That's kind of a complicated thing, but that's data-driven process improvement, which we think then focuses on outcomes.